Thank you guys for being here on this Saturday afternoon. We've been very fortunate at Pittsburgh to be part of the CORSICA Collaborative from its onset. So much thanks to you for making that possible and being able to work collaboratively. We've been very fortunate to have some very high-level people who have been willing to take on some of the very difficult statistics that are required to understand, these unique patient populations. And what we're really looking for up front, and what you're going to see in most of the next presentations, focus on a different part than we've traditionally focused on as doctors. As doctors, we've unfortunately predominantly focused on things like survival. How often do people survive these kinds of cancers? But we understand more and more that living with these cancers and the impact on individuals is tremendous. And so that's why this focus on quality of life, which you're going to see in the next few presentations. So in this initial one, Cara Fleseriu is one of the tremendous medical students at Pittsburgh who actually spent her Dean Summer Research time, which is a dedicated funded position within the University of Pittsburgh School of Medicine, focusing on this database and working with some of the other presenters you're going to hear a little bit later. So with that, she's going to talk about the factors that impact this quality of life when patients first come in with their sinonasal cancer. Cara, why don't you take it away?
Hi, everyone. Thank you so much for coming today. I would like to thank all of my collaborators listed here, as well as my mentor, Dr. Wang. But most importantly, I would like to thank the NACR Cole-Reagins Foundation and donors for their support with their research. The opportunity to work on this project has furthered my interest in cancer research, especially in improving personalized outcomes like quality of life. We know that sinonasal cancers are very rare and very uncommon in less than 1% of all cancers. We also know that a lot of patients present late in their disease and that the presence of many important anatomical structures in the head and neck area mean that these patients generally have a poor prognosis. But like Dr. Wang said, survival does not fully describe a patient's experience, which is why we're interested in quality of life, which is defined by the World Health Organization as an individual's perception of their position in context of their values, their priorities, goals, and concerns. We're specifically interested in patient-reported quality of life. This allows us to hear patients' own voices and how they're feeling, and has been shown in studies to be significantly more accurate than the physician's perspective of how patients are feeling. Quality of life is deeply personal to each individual, but there are some tools that we can try to use to kind of get an objective measure using the same scale across different people so that we can accurately analyze it. And the tools that we'll be talking about today include the Sinonasal Outcome Test, which you'll hear us call the SNUC, and the University of Washington Quality of Life Survey. These have both been proven in other studies to be effective in cancer patient populations. A little bit more about the sinonasal outcome test. You'll see kind of the things that we ask about on the survey, and patients rank on a scale of 0 to 5 how much of a problem it's causing in their life, with 5 being the problem as bad as it can be. And the survey asks things like sneezing, coughing, symptoms similar to that, as well as how the patient is actually feeling, like if they are fatigued, if they're sad, if they have reduced concentration. The University of Washington Quality of Life Survey asks slightly different questions, which is why we decided to use them both in order to get a whole picture of how the patient is feeling. A lot of cancer research, as Dr. Wang mentioned, including sinonasal cancer, has been focused on types of tumors and treatment and mortality, which is incredibly important, but there is almost no data on how these patients are truly feeling, especially when they first present and are diagnosed. We wanted to get a holistic view of these patients and understand the main factors that cause this poor quality of life when they're first diagnosed with cancer, in order to see who could benefit from early general intervention in their symptoms, as well as to be able to improve conversations around symptoms and their expectations. CORSICA allows us to do this because it's uniquely focused not only on the oncologic measures, but also these quality of life metrics and surveys given. And this gives us the ability to answer these important questions. This is the first study of such a large scale, which is prospective, which means it follows patients throughout their journey, and we'll also be able to track their quality of life over time. And it's at 10 U.S. academic hospitals nationwide, allowing us not only to gather a large patient population of what is otherwise a rare disease, but also to work together with skilled scientists and surgeons from around the country to better understand it. We used CORSICA to look at how patients rated their quality of life using the two surveys I discussed earlier, the SNOT-22 and the UW Quality of Life. And we included patients of all ages with all types of sinonasal cancer who had yet to be treated, since we were specifically looking at how their quality of life was before we did any intervention. We looked at their demographics, pathologies, other diseases they may have, and most importantly, their symptoms. We had a little over 200 patients, a little over half of which were male, with an average age of 60, which is a pretty young patient population, but in line with what we know about sinonasal cancer. Unfortunately, as we know, many of the patients had high tumor staging, which is reflective of the worst stage of tumor, representative of hard to diagnose cancers like sinonasal cancer. And we had a large array of pathologies represented. And I did want to highlight that we had 20 sinonasal undifferentiated carcinoma patients in our group, which again is a advantage to having CORSICA. We're able to accumulate rather large patient populations of what is otherwise a very rare disease. We were able to show that just as we had thought, quality of life is quite poor in our patients at diagnosis. The average overall SNOT-22 survey score was almost 30, with a higher number being bad. And this is worse than in a healthy population, which is about 9 to 11. And it's almost 3 times worse than a healthy population. And it's even worse compared to patients with other types of tumors. Brain tumors, skull-based tumors, had an average score of 16. So our score of 30 shows that patients with sinonasal cancers truly have bad quality of life compared to many other populations. Now that we had established that quality of life in these patients was quite bad, we wanted to know why, and we looked at the factors that were most associated with this poor quality of life. And we found that they fit into like a couple of buckets that were independently linked to this poor quality of life. One bucket was anatomical involvement. So it was where the tumor was growing and what things it eroded through. So these 4 were independently associated with poor quality of life. Certain symptoms and demographics, like women, people who had industrial exposure, as well as bloody nose and pain, were also associated with poor quality of life. But things that are traditionally important to doctors, like T staging and squamous cell carcinoma and other histopathology, were less likely to influence quality of life than we had thought. In conclusion, this is the first study analyzing the specific factors that influence how sinonasal cancer patients truly feel at diagnosis. We found that bloody nose and pain were more bothersome than other symptoms, and that the size and type of tumor had less effect on patients' quality of life than previously thought. We found that extensive tumors, specifically those that involve the eye, the skull, the mouth, or that invade nerves, were linked to poor quality of life, and that women had worse quality of life than men, and more research is needed to find out why. Further studies to learn more about how to improve these outcomes of patients with sinonasal cancer is needed, and we will continue to do that. Our research in this has been published in a peer-reviewed journal and is now being distributed around the country in order to other colleagues in order to spread the knowledge. Thank you.
Thank you very much, Cara. I wonder if before we move on, we could pause for any questions about what Cara presented. I've got a couple of questions if no one else does. Cara, you used the term T staging. Could you explain to us what that means?
Yeah, so staging is really what a lot of other studies that are looking at mortality and prognosis, that's what they focus on. It's kind of the local growth of a tumor, how big it grows and what it invades. And we really just showed that when it comes to quality of life, it's less about the growth of the tumor itself and more about where it's located.
The other question I have, and perhaps some of your mentors would be able to chime in about this too, is there a way in which understanding and documenting the quality of life problems that sinonasal tumors cause, could that help with earlier diagnosis based on the way a patient comes in and what their symptoms are?
I think that's certainly A very good question, and something that we are interested in seeing if any of the factors that lead to poor quality of life, if we can prove that in the future, maybe these are some alarm bells that physicians across the country should be looking for, that may be different from other sinonasal problems and should maybe point us towards thinking cancer earlier. We currently don't have any data to suggest that certain factors indicate that, but that is something we will continue to look for.